We start our newscast tonight with news about Opioid Awareness. A new free text messaging program is now available in South Carolina. It's called RX Aware. You can get information about opioids, including those prescribed by doctors, as well as non-addictive options for pain management. News 19's Becky Buds reports on the goal, which is to prevent the misuse of these powerful drugs.
Personal, it's confidential, and it's tailored so that individuals are getting very specific education. And this can be parents, caregivers, anybody on an opioid medication.
Sarah Goldsby is the director of the State Department of Alcohol and Other Drug Abuse Services. That's the agency that helped get RX Aware to South Carolina.
It's really a way to learn more about opioids, the risks of them, and how to talk to your healthcare providers about them.
She says in South Carolina, an opioid prescription is filled every 9 seconds, and opioid dependence can develop in 3 days.
There's still work to do. This effort stands to make impact in lowering that rate even further.
RX Aware provides information, resources, and support from health professionals. To sign up, send a text to 55753 and answer a series of questions about you or a loved one.
And so I think when people can just be in the comfort of their own home and kind of make that first step to just get some more information and seek some support, that's wonderful.
Ashley Beaudiford is the director of prevention at the Lexington Richland Alcohol and Drug Abuse Council. She says opioid misuse happens in our communities every day.
So taking somebody else's prescription or taking too much of something that you were even prescribed is really when we get into misuse and unsafe practice.
According to DHEC, in 2020, there were 1,400 deaths involving opioids and more than 7,800 opioid-related overdose hospitalizations. For those recovering from substance misuse disorder like Trish England, this text line can be a lifeline.
Stigma is one of the biggest barriers to recovery because people feel they have something to be ashamed of. Any sort of solutions for, that would lead people to recovery, I believe has got to be a great thing.
In Columbia, Becky Buds, News 19 WLTX.
Well, according to the latest numbers from DHEC, drug overdose deaths rose from 1,131 to 1,734 from 2019 through 2020. 1,600 of those deaths were unintentional. Prescription drugs were the cause of 1,463 of those deaths. And while opioids accounted for 1,400, DHEC's data shows that Richland, Lexington, and Aiken counties experienced more than 50 cases each for opioid-involved overdose deaths back in 2020, which is the latest information we have. Orangeburg, Sumter, and Kershaw counties had between 10 and 30 deaths each.
Well, when it comes to getting rid of unused or unwanted medicines, there are some take-back options out there. CVS Pharmacy offers drop-off location sites at some retail locations, though it's safer through its Safer Communities program, I should say. And some Walgreens stores also offer med disposal kiosk, and many law enforcement departments also provide take-back programs. If you're in an area where there are no take-back or mail-back programs open to you, you are able to dispose your unused or expired medicines at home. DHEC recommends some steps to follow in doing so. First, remove your unwanted meds from its original container. Mix it with an undesirable substance like cat litter, dirt, or coffee grounds without crushing tablets or capsules. Then place the mixture in a container, such as a sealed plastic bag, maybe an empty margarine container, and then go ahead and throw it away.